Sciatica pain, or pain that goes down the posterior glute, down the back of the leg, all the way to the lower leg to the foot. It can be tingling, numbness, it could be burning pain. You can actually get a shooting sharp electric shock that goes down that leg. It could be one leg, it could be both legs. Some of the major causes could be a disc herniation, lumbar spinal stenosis are two of the major causes of it, sometimes a PIRIFORMIS syndrome. And also what's called a segmental dysfunction problem. Also, it could be caused by muscular imbalances that can also cause that type of a pain. Hi, my name is Dr. Rob Bates. I'm a chiropractor and a certified athletic trainer. Today's video, I'm going to talk about what postures are best for sciatica, what to avoid. Also, we're going to talk about the best exercises that you need to do for sciatica, depending upon if you have lumbar spinal stenosis that causes sciatica, or if you have a herniated disc that causes sciatica. Before you do any of these exercises, make sure you check with your healthcare provider to make sure this is right for you. If you have a herniated disc and you have the sciatica, the thing that we want to avoid is a lot of flexion. Where if you have a lumbar spinal stenosis and you have sciatica, well, you want to avoid a lot of extension. Now, the reason why is because with a lumbar herniated disc, the disc material, that jelly substance, when it's herniated, it's pushing back against the nerve and it creates a sciatic symptom. So if you do a lot of flexion, it's going to keep pushing that little jelly back into it, the nerve, and it's going to get worse and worse and worse as far as your sciatic symptom. So when you have lumbar spinal stenosis, these little holes that the nerves come out of are already narrowed, and if you have swelling, inflammation in there, that further narrows the hole. Then if you extend back and you're doing an extension type of exercise, that closes down that hole, so it's going to irritate those nerves. So with sciatic symptoms caused by herniated disc, you want to avoid excessive flexion and a lot of flexion. And with lumbar spinal stenosis, you want to avoid the extension type of exercises. Now for sitting postures, when you're sitting at your desk, for both of these, what you want to do is try to get away from that hunchback position where you're stuck more in a hunch position where you head forward. For both the herniated disc and lumbar spinal stenosis, you want to sit up on the edge of your chair at work. And when you do that, you're on the sits bones. You want to spread the legs out. And the reason why you want to spread the legs out, because when you're stuck in a flexed position with your legs out, it's real difficult. You take away the bracing of the legs underneath. So you spread them out. You instinctively are going to start bringing your shoulders over your hips, and your head will follow. And you get up in that neutral position. And you may want to brace a little bit with your abdominals, so you're more in neutral position instead of too much flexion or too much extension. So sitting with sciatica, you try to get up on the edge of the chair, keep the legs spread, shoulders over, the head's over, brace the stomach a little bit, and then you're just going to get up and down throughout the day, from sit, stand, desk to sitting, periodically throughout the day, so you can get through the day. And that's a habit that you should get into anyhow, because it will help preserve your spine. Now, if you're sitting for long periods of time driving, even if you have a lumbar support, it's not going to be enough for people, especially with the herniated disc. So what you want to do is you want to grab a water bottle, and this is where when it's in an acute pain, you get like a plastic water bottle, about a 16-ouncer, and you can freeze it with the water in it and put it about the level above, here's the belly button, so right about the belly button or a little above, and you put that in as you're sitting in your car, and you get with your shirt pulled up so you can get the icing on it as you drive to work. Same thing goes for on a flight. What you can do with the flight is, at least you can do, is you can bring a water bottle, put it back there, and that'll help take some of the pressure off that, and for a herniated disc, at least preserve some of the curve of the spine so you're not stuck in a sit-down flexed posture. When you're sitting long periods of time, the pelvis will just flatten out this way, and once again, it pushes the disc, and it's going to migrate back and put pressure on the nerves, make the sciatic symptoms worse. Postures as you sleep with the sciatica and you have a herniated disc is you want to try to put a little bit of like a soft rolled up towel underneath so it will preserve some of the arch. While you're doing that, you can lift your legs up, and by lifting up the legs it takes some of the pressure off the hip flexors, so it'll relax the low back, and this will take some of the pressure and allow the disc to migrate forward a little bit instead of all night flattening it out and pushing the disc back. It's going to be more irritated. So with lumbar spinal stenosis, it's going to be the difference will be you can use pillows, lift the legs, and not have the towel in there. So you can start off back, and then you can go side and side as you sleep. So with herniated disc, get a little towel, put it underneath, elevate the legs, and you can sleep like this, starting off. If you have lumbar stenosis, you pull out the pad, the towel, allow it to slide, sleep this way. And if you want, and you can go from side to side. So you can put the pillow in between your legs. This is typically a real comfortable posture for lumbar spinal stenosis. Sometimes you have to change that posture throughout the night, especially when it's in a really acute sciatic symptoms. Now, when you have sciatic symptoms, it's also real important that you don't do a lot of repetitive flexion and lifting. It doesn't matter if you have a herniated disc or lumbar spinal stenosis, it really irritates those areas. So you want to keep more of a neutral posture. So you want to brace the abdominals, you want to keep hip hinge as you lift. So you keep a flat back or a neutral back, brace abdominals, and you hinge from the hip when you're going down to lift things. Or you get assistance, so if you have to pick up a toothpaste cap or something off the bed, you want to bend whatever you can. You want to get some assistance. You can use your legs as you pick up, hold on to something, hold on to the bed as you're lifting something up, to the sink. These are all things. So you want to really watch the repetitive lifting and twisting with sciatic symptoms. Doesn't matter if you have a herniated disc or lumbar spinal stenosis. And you just want to make sure, brace the spine, hip hinge when you do that. You're protecting those areas. And once again, you should do that. Even if you don't have sciatica, you should put that into practice so those little micro traumas doesn't create more damage for the joints. But as you stand with herniated disc, is that you want to make sure you contract the glutes, but then also brace abdominals, and with the feet you want to try to screw the feet into the ground so you get this torquing feeling. So it's as if your toes are grabbing the ground and pulling out this way, externally rotate, and it will cause a little torquing, so it actually naturally contracts the glutes, and you brace the stomach. So you want to, as you're standing, and you have to stand for any length of time, you want to engage those areas and try to bring the shoulders back over center if it's pain-free. Initially with the spinal stenosis, you're going to have to be a little bit more flexed position, because that flexed position does open up the hole and allow some of the pressure to come off that sciatic nerve and give some pain relief. But both you will have to eventually get back to that neutral posture I was just talking about for stance. Now the exercises are going to be different. The Difference is with the herniated disc, you want to get on your stomach more and you want to work the extension type of exercise, because that will cause a natural curve in the low back and allow to push or migrate that disc back into a normal position to start healing in normal position. Like this, to where you're going to rest on your elbows. And you want to rest on your elbows and hang out here. You start off about 30 seconds to 2 minutes. And you can come back out of that. You can do some cat-cows to loosen up the back. Go back down. Try to do another 30 seconds to 2 minutes. And you want to eventually get it up to about 10 minutes. And when you're in that more chronic phase of sciatica, you're going to probably have to do that several times, about 2 to 3 times a day. Once the symptom dissipates, then you want to definitely do it once a day. Sciatic symptoms caused by the lumbar spinal stenosis. We want to temporarily get rid of this curve here, so we open up those spaces again and relieve that narrowed space where the nerves are getting squashed and open it up. So it's going to be flattened out. So we're going to work more of the abdominal crunches here, abdominal curls. You want to brace the abdominals as if someone's punching the stomach. It's braced. Lift the head up off the table about 1 inch. Contract, reach. Do it for about a 10 count. Relax. Brace. Contract for about a 10 count. Relax. And you want to keep repeating that. Do it about 5 to 10 times. And when you're more in acute sciatic symptoms with the lumbar spinal stenosis, you're going to have to do that either every hour or every 2 hours until the symptoms dissipate. And then for sure, you want to do that twice a day just for maintenance. With that, for the lumbar spinal stenosis, once you're completely out of the sciatic symptoms, you can change that up, start restoring the curve a little bit, so you get that towel roll, put it underneath the belly button, and then you can add your exercises in there. Brace, lift your head up, start reaching. Do it for about a 10 count. Relax, brace, 10 count, and relax, brace. And you want to try to do about 10 of those a day. Now, piriformis syndrome can also cause sciatic type symptoms, but typically piriformis syndrome, along with muscle imbalances and trigger points that are in the quadratus lumborum and in the glute medius and minimus, those things can also cause a posterior leg pain. And so you're going to have to do other types of exercises. So I want to hit a couple of those right now. For the piriformis, what you need to do, and once again, you want to do these all to where it's pain-free. If you start doing these and you start feeling a pinching or shooting pain, you want to back off. That means you're not quite ready for it at that time. With the piriformis, you want to first start off coming in, just lunge into it, because I'd like to stretch out first the hip flexor. And so you want to contract the abdominal muscles, get up on a bench, lean forward the best you can. Make sure you're not arching too much in there. You're going to try to get a little contraction if you can of the glute. You're going to feel it stretch through this area here, but also you should feel it in this front. If you're not, straighten out that back leg more to get more of a stretch here. You just come in here, stretch for about 30 seconds, come up. Second time, come down, reach up, lean to this bent leg side. You're going to feel it open up. You're going to get some of the QL and also stretching. You want to hold that for about 30 seconds more. Then you can come back up, switch sides, contract the belly, lean forward, straighten out that back leg. Make sure you're not arching. Then you stretch forward about 30 seconds. Feel it stretch in the front and feel it stretch through the hamstring and glute. Come back up, come back down, reach up over and stretch into the bent leg side. Once again, you're getting the QL, getting some of that psoas in there. Now you can come in, you can stretch the piriformis more. Come up, get more into a pigeon. So come in here, you start off, support your body, but lean forward, get that stretch, about 30 seconds. Go from side to side. So you give yourself 30 seconds to a minute, come back up, switch legs. You're going to definitely find one side tighter than another. You may have to spend a little more time. Try not to flex forward. You want to keep a neutral posture when you're doing these right now. Because too much flexion or extension when you have that sciatica, it's just going to irritate that nerve area because the nerve is still sensitive. So to keep the neutral posture, come back up. You can do a few cat-cows. And you can repeat that several times throughout the day to free up that piriformis. Now, this one I want you to do is a spinal twist. You want to bring your leg over, put on your toes, spread your arms out, contract the belly, twist, rotate. You're going to feel it stretch all the way up through some of the glute medius. Keep the quad contracted. Relax. Go to the other side. You can do this for about 30 seconds to a minute and repeat that several times throughout the day. Both sciatic symptoms caused by lumbar spinal stenosis and herniated disc, what you need to do is add in some walking, a lot of short little walks for about 5 minutes. Do several of them throughout the day. It'll help decrease the lymphatics, the swelling in the area, which the swelling, once it starts coming out of the joint, will decrease the pain. Just the movement of the joints will allow it to have some pain relief. So periodically when you're doing those walks, you want to do decompression. You can either hang from a bar, and the only difference is when you're hanging and you have lumbar spinal stenosis, you want to keep the abdominal muscles contracted more so it doesn't go into too much extension. Or you can go ahead and decompress by hanging off of a wall or a bench, by hanging off it this way, locking out your elbows, letting your elbows go against the curates where it takes pressure off your arms more. Let the legs relax. The contractions decompresses that area. Do it for about 10-15 seconds, then walk again. That pumping, that decompression will also start moving that joint around, decreases the pain. Segmental joint dysfunction is when you have one of the spinal bones through an injury, and it can be an injury from years ago, gets locked, doesn't move properly. So as the spine's moving around, it doesn't move properly, it creates damage, and you have a lot of the muscles that have to compensate around it. It can actually start to change the curve that way. It causes the decrease or change of the nerve impulse going out to the muscles to where you're going to have muscle imbalances. So to take care of those segmental dysfunctions, you have to get the specific joints freed up. And the only accurate way to do that is to get a specific chiropractic adjustment. Into how do you know what type of lumbar spinal stenosis you have? Number one, you should get an MRI. Now an MRI, the best way to do an MRI is more of an upright MRI. The upright MRI would be where either sitting in a tube or you're standing in this tube, and they take the MRI picture of that point. And opposed to 99% of all MRIs can be ordered are going to be a flat tube where you go in, you're sitting there in the flat tube. The problem with that is that it's very bad. It doesn't tell you any type of what's happening with the gravitational pulls on your joints and what type of pressure is being put on that spine. So by far the best is going to be an upright MRI diagnosis to see if you have spinal stenosis or can measure out the disc. Now the other thing is, through my 38 years of practice, is I have seen that a lot of people have had herniated discs and diagnosed with that, even spinal stenosis, but they still are not able to correct their problem because they need to get a motion x-ray to where they can see how the spine is moving. So you want to see what is happening to the functions of the joints. An MRI does not give you that information. A standing x-ray where you would flex, do a neutral, then you'd flex the side, take a picture, come back, do the other side, and it tells you, and it'll diagnose where there's a segmental dysfunction not moving right. And a lot of times that's going to be not in the spot where they're showing up with the herniated disc or the spinal stenosis. So getting an accurate diagnosis is very important first. Then it gives you a better idea on how you should be addressing this area so you can get complete correction of your sciatic symptoms. Sciatic symptoms are correctable. It's just finding what is the specific cause and then making it tailor-made for you in order to get to your maximal correction.